I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to go over why do I have knee pain when I run. So this is a really common thing that we see in our clinic is people who have knee pain only when they run. It starts when they run, then it usually progresses to going down the steps or, everyday life or whatever. But a lot of times it starts just as I have knee pain when I run. Now, mileage is ramping up. 5K, 10K season is coming in May, so we're in April next week, and people are really starting to ramp up their mileage. So this is a really common issue. A lot of people run through it. Common things I hear when it comes to knee pain when I'm running: hurts me for about the first mile. When I get going, I hit my stride, it goes away. It doesn't go away. We're going to talk about why it doesn't go away, but it doesn't go away. Or another one I've heard, or another one that I hear quite often is, I'm a mile into it, 2 miles into it, and I can't run anymore. I have to do a run, walk, or, it starts to really come on at mile 2, and it stays about the same. And then, unfortunately, the one where I hear I was not able to finish the race, my knee hurts so bad. It was fine up until that day. I would get a little twinge here and there. I knew it was, uncomfortable at times when I ran, but then I got to the race and I couldn't run anymore. So we're going to go over a couple of the reasons why your knee hurts when you run and kind of what you can do to fix that. So first thing is, if you are getting knee pain, hip pain, back pain when you run, all right, the first thing is run alone outside. I know, sounds really creepy, doesn't it? So we're going to break that down. Run alone outside. So first things first, a lot of people like to run in groups. That's what they do. They find a partner, you find a running buddy, you find a significant other, and you go for a run. Many, many, many times, 99% of the time, you and the person you're running with are not the same speed at all. A lot of times there's a big discrepancy. Maybe it's only 15 seconds a mile that you're off. So you kind of, as the faster runner, will slow it down a little bit just so you can have somebody to run with. What happens is when you go and you go slower, you have to change how you run. It's not just a matter of, oh, I'm just going to do the exact same stride, the exact same mechanics, and I'm just going to run slower to run with this person. You have to alter how you run in order to run at a slower pace or at a faster pace if you're trying to keep up with somebody who's faster, or if you're trying to keep up with somebody who's a little bit slower, you have to slow it down. You have to change how you run in order to do that. This is like my flip-flop thing is, one of my, the number one thing when people come in and they're like, I get a lot of pain when I run. Start running by yourself. If you are running in a group, you have to, absolutely go with a running club. They're great. There's a lot of them out there. But when you are going, just make sure that you're just kind of, doing their mileage, but you're running by yourself. You're not trying to keep up with anybody else, or, whether that be faster or slower, because that changes your stride. Outside. So outside means outside. So this is where, people are like, oh, running outside hurts. When you run on the treadmill, it forces you to keep a constant speed. So when you're running outside, you're, let's say, a 10-minute mile or a 12-minute mile or a 6-minute mile or whatever you are. Your Garmin reads 6 minutes every mile or whatever. It registers you every mile, and you kind of, as you cross the mile, your Nike, if you're using the Nike app, it'll talk in your ear about your pace and the mileage that you're on. What happens during that mile is there are parts where you are faster and there are parts where you are slower. And the difficult part with running on the treadmill is it keeps you at a constant speed. So especially if you're experiencing knee pain, your body doesn't adjust for that pain. It actually just is forced to keep up the same exact pace the entire time, which is not healthy, and it's not good for your muscles, and it's not good for your knee. Yes, running outside when there's hills and there's curbs and there's different surfaces does make that harder. When you run outside and you're experiencing pain, you want to try and run on a flat surface. You want to try and make sure that there's no hills, and you want to try and make sure it's as level as possible. A tough task, especially around here where I live. But, you know, even a track is actually pretty good for that, especially if you're not running long distance only because of the turns. But just having that flatter surface to run on is going to help. But stay outside so you're able to adjust as you feel. And the thing is, you're not going to know you adjust. When you run, you don't know when you go faster or slower in increments. That's okay. Your body does that for you. So the second reason why you have pain in your knee when you run is you have muscle imbalances. Okay? Muscle imbalances. What does that mean? Some muscles are stronger, some muscles are weaker. Okay? And this all comes together at the knee. Muscle imbalances are found in your core, your hip, and your abdomen, your hip, even into your foot. And what happens is because there's no real muscle that is at your knee alone, like your quadriceps, the muscle up front, or the muscles up front. Start at your knee, they go up to your hip, okay? Or, you know, some of the muscles in your legs. Start at your knee, go down to your foot. You have these muscles that span the entire leg, okay? A lot of times, many times, the front muscles, the quads, are way stronger than the back muscles. They are really way stronger than this posterior aspect, your glutes, your hamstrings. And this causes a lot of running up front, as I call it. So it causes a lot of hip flexion. When you run, you really should be doing more of hip extension. Now, when I get people on the treadmill and I'm doing gait analysis, you wind up seeing a lot of deficiencies. And you wind up seeing people being more here as opposed to back here and extending, okay? And it's important to fix these muscle imbalances, and we're going to talk about how we do that now. What you need to do is we need to strengthen, we need to foam roll. Okay, so stretching, great. You need to do it at times. This is more important. If you're picking between stretching and foam rolling, this is what you need to do. I'm going to post a link to our guide to foam rolling. In the section, we have a free guide that we give you for foam rolling because it's that important. That's going to take you through all the stuff you can do. But I'm going to show you just a couple things, actually my favorite exercise for this. You want to open up your hips. So what you're going to do is you're going to sit on your foam roller. Do you need a spike foam roller? Yeah, you do. You have to get the spikes in there, all right? And you're going to just cross your ankle over your knee, and you're going to roll back and forth. You want to lean to the side that's crossed. You feel a little bit of pain in some points. You want to stop, roll over that, and then keep going, okay? You want to do about a minute on each side. You can do that throughout the day, a couple times a day. If you keep this at your desk, you can do that a couple times a day. Again, I'm going to post a link to download our free foam roller report so you are able to actually see all the exercises that need to be done. At the end of the day, this should touch your leg everywhere. Should you do it every day? Yes. When people come back to me who have been to me before, the first question I ask is, are you foam rolling? No. Okay. There's your answer, all right? Then we need to strengthen, all right? Many people, when they start to strengthen, they do knee exercises because their knee hurts. So we're going to do knee exercises. Not the case. If you're doing anything that resembles this, okay, where you're working your quad, you're not working the right stuff. All right, so the first exercise, well, the exercise I'm going to show you that really is going to help is just doing some hip hikes. So all you're going to do is bend this knee, okay? You're going to drop your hip down and bring it up. And then you're going to drop it down and bring it up. Nice and slow, okay? This knee does not bend. It does not straighten. It does not bend, okay? It's not locked out. It's nice and easy. It's bent a little bit. Drop. Well, not like that, but drop and then raise. Drop and raise. You're going to feel it in this leg. Not going to feel much in this leg. This is an endurance exercise to strengthen your glute medius, which controls a lot that goes on in your foot and your ankle and your knee. You want to do about 3 sets of 30, okay? There is no weighting this. You just want to do it with your own body weight. You can do it on the step. Nice and easy. You want to try not to touch down on the ground. Muscle imbalances, number 2. Number 3. Footwear. Okay, Footwear is really big. If you haven't been fitted at a proper running store for footwear, you should. It's important that you have the right shoes on your feet. The trendiest shoes are not always for you. So once you figure out exactly what is for you, maybe they are the trendy shoes, maybe they are the Newtons, maybe they are the Hokas, whatever. Find the shoe that works for your foot, okay? If you're doing 13 miles, you know, you're doing 6 miles, you're doing 3 miles, every time you hit the ground, the first thing and the only thing that should hit the ground is the foot, all right? So if the foot is not being controlled correctly by that shoe, you're going to have problems. It all kind of starts, you know, when the foot hits the ground, that's where everything starts to transfer up the kinetic chain, up the leg. So we really want to make sure that you are wearing proper footwear. Get fit for a proper running shoe. If you have a flat foot, if you overpronate or whatever, you know, look at the wear patterns on your shoe. This is a really important step when you get involved in running. You don't have to necessarily get the $120 pair of running shoes, but you do need to make sure that you have a proper shoe that fits you. So those are kind of the top 3 things of why your knee hurts when you run. And the number one thing that I want you to take away from this is the fact that when your knee hurts when you run, it has nothing to do with your actual knee. All right? It has everything to do with other things going on. The knee is the hub of a lot of activity. So it's not the fact, there's nothing that I would say, you know, we need to work on your knee. If you have knee pain when you're running and someone's actually working on your knee, you are missing the entire point and you're not going to get better. And the minute you get back out there, it's going to start to hurt again. So you want to make sure that you are addressing hip and ankle when you have knee pain. Know that it comes from more than that.